Okay, so my patient today is a 65-year-old female that has been experiencing left shoulder pain and over the past couple months has been gradually losing range of motion. She is now at the point where she can no longer fix her hair or reach above her head in the cabinet for her coffee mug. So with those, I'm suspecting possibly a frozen shoulder. We are going to do some further tests to assess it and see what the final diagnosis is. So first off, we've already cleared her C-spine, so we're gonna go ahead and move on from that. But I'm going to just go ahead and get her normative ranges for her shoulder, and then we will go into our manual therapy. So I'll have you go ahead and take your shoes off and lay down. All right, so now I'm gonna go ahead and look at her range of motion. So I'm gonna ask you to go ahead, your arm, bring it up as far up as you can by your ear. Okay, I'm gonna see if I can get a little bit more. Okay, I'm gonna go ahead and just measure it. Give me 1 second, we'll let you rest for a second. I get my goni set up. Okay, whenever you're ready, as far as you can go, I'm gonna help you, all right? Okay, so it's measuring in right at about 125. And normative ranges for shoulder flexion is 180, so there is a significant decrease of her range of motion. So now I'm just gonna go ahead and assess her capsular availability. So I'm just gonna lower you just a little bit. Actually, I lied. You're gonna go back up. Sorry about that. Okay, so I'm just gonna go ahead and distract the humerus. I'm gonna see her posterior, anterior. I'm gonna switch over to the side to see her inferior capsular availability. Okay, so there's some tightness there. So I'm gonna go ahead and perform the inferior joint mobilization, and that's how there's gonna help stretch out her inferior capsule and maybe just give her a little bit more degrees for shoulder flexion, okay? You doing okay? Mm-hmm. All right. Same thing. Okay, doing all right? Mm-hmm. So for this, I'm gonna go ahead and perform a grade 2. Being that she is still experiencing pain, we're gonna work on that pain inhibition. We're gonna do this for a total of around 8 minutes, depending on patient tolerance. We're gonna do 15 seconds on, about 5 seconds off. Still doing all right? Mm-hmm. Okay. And like I said, hopefully this may aid in a little bit more of range of motion above head, just stretching out that inferior capsule.